One of the most difficult and challenging cases I think that I'm confronted with today in implant dentistry is treatment of the congenitally missing lateral incisor. And the reason I say that is basically for three specific reasons. The first reason is that we are treating an area in the aesthetic zone, okay? And this in itself makes this a very difficult and challenging case. The second reason why I feel like this is a challenging case is because all of these patients require some type of augmentation procedure, because every one of these patients presents to us with some type of deficiency, whether it's a bone deficiency, a soft tissue deficiency, or a combination of the both. Every one of those patients requires some type of augmentation procedure, whether it's simultaneous implant placement or in a delayed or two-stage procedure. The final reason why I think these are very difficult or challenging cases is because of the amount of space that we have to work with. The average size of a lateral incisor is anywhere between 5.5 and 8 millimeters wide. That's kind of a large range, but when we're talking about restoring a tooth that's only 6 millimeters wide, this puts us in a very difficult position. Traditionally, we've had wider platform implants. So putting a wider platform implant in an area which we have a narrow mesial distal spacing can result in recession on the adjacent teeth. It also limits our restorative colleagues in having enough running room to be able to develop the prosthetics and the soft tissue there to get an aesthetic result. And about 7 years ago, there was only one narrow diameter implant on the market that was available for these types of cases. It was a one-piece implant. It was difficult from a prosthetic standpoint because the implant had to be placed in a specific position in order to get an aesthetic result that everyone wanted. It was also difficult for restorative colleagues to be able to restore. The OsteoSpeed 3.0 implant was the first two-piece narrow diameter implant that was on the market. And this has been my go-to implant of choice, or what I call my specialty implant for these particular kind of cases. Congenitally missing lateral incisors, lower incisors. There's about 6 million people congenitally missing one or more lateral incisors. So this is a large population of people that we're treating.